Hi, class. It's Dr. Lindner. We are going to be talking about the skin. We're still on the integumentary system. And a concept that comes up is something that's called dermatomes. Now, dermatomes is a neurological mapping of the skin where you can see that we have like C5 controls the sensation up here, C6 nerve root in the neck controls the sensation down here. Then we have C8 over here. And you don't have to memorize these. This will come up again when we do neurology on another exam, but just want you to see that every single level in the cervical spine, in the thoracic spine, in the lumbar spine, and even in the sacral has nerves that come out and they control sensation and what we feel. So sometimes people may have numbness or tingling to the thumb or to the index finger. And it tells us what level within the cervical spine, what nerve root is being impinged. Sometimes their pinky goes numb or the inside of the forearm goes numb. And it just so happens that the inside of the arm and the inside of the forearm to the pinky, which is happens to be the C8 and the T1 nerve roots, happen to control the heart. And isn't it interesting when someone's having a heart attack, where do they feel it? They feel it down the inside, the the C8 and the T1 dermatome, the skin over here. So the skin over here, the same nerves that control the skin here also control the heart. Sometimes people experience numbness and tingling into their thighs. And again, each region reflects a region of the spine. So classically, we have the top of the foot or even the great toe and the top of the foot. It's the lower lumbars around L5. And underneath the foot happens to be sacrum, like S1. Around the belly button is around the T10. Around the nipple area is T4. And the way we come up with these, it looks kind of random, right, in this type of positioning. But the way that they come up with these is in a quadruped type of position. And then it kind of makes sense. Cervical, thoracic, lumbar, where you have C2, then C3, and then 4, 5, 6, 7, 8. And it keeps going T1, T2, all the way down. And then it kind of makes sense. When we look at it from the person standing up, you're like, this just looks so random. How do they come up with these? Um, but an interesting thing is that you don't see a dermatome for C1. You don't see a dermatome for C1, and you don't see any dermatomes around the face. The face happens to get its sensation from a cranial nerve, which happens to be cranial nerve 5, the trigeminal nerve. Trigeminal, tri means three. It actually has three divisions, a layer to the eyes, the maxilla, and the lower jaw, and they all kind of meet up. So trigeminal, this is the nerve that the dentist hits with Novocaine when half your face goes numb, so the dentist can work on your teeth. When people have cervical injuries to the neck, it's common to have paresthesia, which means abnormal sensation to the fingers. When there's subluxation or impingement to the lower back, it's common to have pins and needles down into the lower extremity. Sometimes it's lightning pain or shooting pain, which people can have. So these are called dermatomes. And when we get into neurology, we'll also get into myotomes, and myo means muscle. And what we will end up learning is that each muscle region is controlled by a certain nerve root, meaning maybe the wrist flexors or wrist extensors or finger flexors and finger extensors or elbow flexors and elbow extensors. They too have a common origin in the cervical spine, called myotomes. And then we'll also discuss reflexes. So for example, when your doctor checks your biceps reflex over here by hitting a reflex hammer and you get that jerk reflex of the elbow flexing, well, that happens to be a good C5 reflex. And when they tap the reflex hammer over the brachioradialis muscle, that's a C6 nerve root reflex. And then when they tap over here on the posterior on the triceps muscle for elbow extension, that's a C7 reflex. So there's dermatomes, myotomes, and reflexes. And whenever there's nerve damage in the neck or lower back, your doctor, whether it be a medical doctor, a doctor of chiropractic, a doctor of osteopathy, we will check dermatomes, myotomes, and reflexes to support the findings of, okay, is there a C5 impingement? Well, maybe there is a C5 impingement because the patient is complaining of numbness to the shoulder, and that's a C5 area. Well, maybe they can't abduct their arm. Arm abduction is controlled by C5. So if they can't abduct the arm, and that's controlled by C5, and they have numbness over here to the C5 dermatome, and the biceps tendon reflex is shot, that's a pretty severe nerve impingement. The dermatome, the myotome, and the reflex all at the same level are shot. So that's how these things are used, and the skin could be used to give us some diagnostic clues. Okay, when we come back, we'll get into the epidermis.